Hey everyone, it's Colleen Nielsen, the Director of Lake County Public Health Agency here. Recognize most folks on the line at this point in time. We might just give folks a few more minutes, including Dr. Zwerdlinger. I would just like to share a little funny personal thing that just happened a few minutes ago. I was prepping to kind of come into the other room and begin this meeting. I was brushing my teeth and our house isn't the biggest, so I'm kind of out in the hallway and my husband's right there, and he was like, "Why are you brushing your teeth? Are you going to a meeting?" I was like, "Actually, no, we are practicing good social distancing. It's a Zoom meeting, so I just want to share that I did brush my teeth for all of you on this meeting, even though you're not going to really get close to me." But anyway, looks like Lisa is on, so we will get started. So thank you again so much for being here tonight. Hopefully you are finding that these sessions are valuable and continuing to answer your questions. We'll keep doing them until we think we don't need to, if you will. But obviously we'll give you a heads up. We'll give you information about what that might look like going forward. The big things that we have coming up in the next 2 weeks is on Monday, the governor is going to be talking about kind of where we're at with the Safer at Home order. As you guys know, we've been in this public health order since about April 27th, and he is going to update and see what we can or can't do. We are planning on opening our restaurants, not our bars, just our restaurants and our lodging on June 1st. We should get additional guidance on that on his call on May 25th. So those are kind of the big pieces that we've been working on behind the scenes. We had a meeting with our business community today that I thought was successful in answering questions and understanding the process that we need to keep moving forward. This isn't necessarily a wide open door. Everything that we're doing continues to be that social distancing piece, good hygiene, wearing face coverings in public, and making sure that you're staying home when you're sick and or not interacting. So there's some screening pieces in there as well, especially around some of the business protocols that have come out. I'm trying to think about anything else to share before we jump in. But just we continue to work with our partners. We continue to monitor the situation. We keep talking about the fact that we're trying to go in incremental steps. A lot of you have seen the phases that we're working towards. We're still in that initial phase in the green circle and kind of seeing what's happening not only here, but in surrounding counties. So with that, I will turn it over to Dr. Zwerdlinger.
Okay, thanks so much. So I thought that I might start by just going over some of our local data from what we've seen. Colleen, is it okay if I share my screen?
Yes, absolutely, please do.
So apparently I don't have permission to do that. Can you all see that? Great, okay. The first thing I wanted to talk about was why I do this. And so what I've been doing for the past several weeks is I've been looking at the state data and presenting that to anyone who's interested in looking at it, and then comparing the state data to the Leadville data so that we are all on the same page. Obviously all of these decisions are being made both at the state and the local level based upon our data. And so how many people are infected, what are the trends look like, and then is it safe? Are we meeting the Colorado Department of Public Health's guidelines to move into our next phase? And so I'm just going to do this quickly, but obviously if there are those that have questions, please don't hesitate to raise your hand, and then I can certainly answer those as we go along. But this is the average cases in Colorado, and so you can see here that the peak happened sometime in late April when we had a couple days there that 600 to 700 cases during those days. These little peaks here that you see are during the week. These days usually correspond to what happens, Monday and Tuesday, because there are less tests that are done on the weekends. But the overall trend is that there are less infections or less positive tests that are happening every day as we march through May. And the average in Colorado is somewhere between 300 and 400 tests. Here is just the cumulative phase, and if you look at what happened, here represents the stay-at-home guidelines, and so you can see that the curve began to flatten, and then there's just a little tiny uptick in the slope here that looks at what happens after we have the safer at home, where we've actually done more exposures. This are the deaths in Colorado, and it's great that we've had just very few deaths over the past week or so with our cases. And so if you look a little closer, the deaths in Colorado are not increasing even after 3+ weeks of the safer at home guidelines. Here is what the data looks like locally in Lake County. And so again, you can see our little peak here in the endish of April, when we had 5 positive cases on one day. That was our biggest day. And then again, the trend going down, and we've just had a little trickle of cases that have come through in the last couple weeks, which is very reassuring. And then this is the overall data, which shows that we have, our little less than 30 cases, 26, 27 so far. But we have achieved the flattening of the curve as we have followed our socially distancing, wearing our masks, staying home when we're sick. And so our measures of controlling the infection with what we've done thus far is working really well. And so, congratulations to us for doing such an amazing job. I do think that as long as we continue with what we're doing, that we'll still have lots of success. But please do know that we are following the evidence, we are following the data, and all of the recommendations that we're making are based upon the number of tests and the people who have tested in our county. So thanks to everyone who's also doing that, and please make sure that you do continue to come in and be tested either here at Rocky Mountain Family Practice or at St. Vincent's General Hospital, so that we'll continue to be able to gather this data. All right, that's all I had. Are there any questions for me?
Just a reminder that you can unmute yourselves or use *6 if you're calling in and would like to ask a question of Dr. Lisa. You can also put it into the chat box and I can read it out for her. All right, not seeing any. Are there any questions for Colleen? And we also have representatives here from Lake County Public Health Agency Environmental Health Department, Jackie Littlepage and Becca Bear, who can also field questions regarding their processes for supporting local businesses in reopening. Or Commissioner Marcella, if you would like to go ahead and share with the group, go ahead.
Thanks, Beth. Good evening, everyone. This is Commissioner Marcella. I just wanted to give an update of the work that we're doing at the county level as the board. So we've been extremely busy looking at moving into economic recovery on a local level, regional level, and a state level. We do know that this is going to have severe impacts on our budget locally. just through our local economy and from the state level based on the budget cuts that are happening at the state. So we are working through that and moving into that recovery phase. We've also been participating closely with our reopening phase with our regional partners, and we recognize that going through this public health pandemic and public health emergency, that it's important for us to be a good regional partner. We don't want to do things too quickly to set ourselves back further, but we also don't want to do things too quickly to put our regional partners that we rely so heavily on for some of our medical necessities and service necessities in a position where we run out of resources regionally. So we are working with them. I'd also like to just take a moment here to let Colleen add on to this as she sees fit, to really make it known that we are not continuing to be more conservative or less conservative than the state safer at home orders. We are working in tandem with those safer at home orders because we feel that those fit where we're at while we're navigating this pandemic. And we're not by any means tailing behind our regional partners. Our regional partners are moving through this in a pace that they have the data to move through according to what's happening in their communities, but working with us as well. And so, you know, meeting with those regional partners and those regional economic recovery groups, we can see that, you know, we're still following lodging opening up at a similar pace, restaurants opening at a similar pace. So no, we're not in a position where we're continuing to be closed while everything around us is opening. We're moving at a pace that is very similar to how the pandemic has reached us and how we're recovering from the pandemic. So Colleen, I don't know if you have any other information to add to that, maybe to walk through what it looks like when we hear through news outlets that regional partners are submitting for variance requests. They're not submitting a variance request to the state health department to rip off the Band-Aid and completely open their economies. And maybe you can talk through that a little bit.
Yes, absolutely. So when the Safer at Home public health order came out, there was an opportunity, which now Colorado Department of Public Health and Environment, so CDPHE, realizes now that that may not have been the best process as far as having counties have the ability to kind of pick and choose if you want the things that are in the governor's orders that they feel that they can move at a quicker pace, if you will. So with those variances, as Kayla said, it's not a door wide open. So having looked at multiple variances that some of our regional partners, as well as other folks, you know, in the state have submitted, it continues to be with all of the social distancing measures in place. It's not a business back to normal. We are all living in what we're calling that new normal, in the sense of social distancing, remaining 6 feet apart, wearing face coverings, good hand hygiene, and, you know, staying away from folks when we're sick. That goes into the variance process as well. And so each and every variance, and the most that I've seen were truly around restaurants, you know, wanting to open sooner, but with the same parameters that we're putting in place for our restaurants. That is no different. It should also be noted that because of the flood of variances to the state, they haven't been able to process them. So it's about a 2-week behind, which also puts most folks, you know, in the same boat that we are, you know, opening just at the same time that we are, as the governor, as we anticipate, is going to make that announcement to open our restaurants, you know, by June 1st. That will be a new public health order that will come out. We'll also adjust our public health order as well. The only thing that was different in our local public health order than the governor's was around lodging, that we weren't allowed lodging in our community because we did not want to have an influx of people bringing in that infection when we realized that's what was happening, you know, in other places. We were doing that in conjunction with Eagle and Summit and Picken and Park and Chaffee County. So at this point in time, we are all looking to open our lodging here in the next 2 weeks. And so to Kayla's point, we are continuing at a pace that we feel comfortable so that we can continue to slowly open that door as we move through these different phases, and recognizing that, you know, what we do today will be reflected, you know, in 2 to 3 weeks in the data. And I think that's something to recognize as well. This isn't an instant, hey, we did this and we're all fine. You know, we don't really know what fine looks like for a couple of weeks. And so I think I understand how challenging that can be. But we are, you know, continuing to monitor what's happening locally. We're continuing to monitor what's happening regionally across the state, and participating in, to Kayla's point, being good regional partners and local partners. And, you know, we are all in this together, and let's continue to move forward in a safe way.
Colleen and Lisa, this is Commissioner Mudge. I have a question about some inquiries on information that has been shared about a potential peak coming for us locally, potentially in July. I think the question is, what does this really mean for us? And I think that the answer really is, you know, because of these potential spikes or ebbs and flow of cases that we really cannot predict. This is exactly the reason that we're, you know, moving incrementally, as you all have been explaining. So Dr. Lisa, could you maybe give us kind of an update on what the anticipated trend may be, though that is probably a difficult question to answer?
Yeah, no, exactly. So if you look at the, I remember the graphs that I showed, we did show a peak in the end of April. And so that was the first peak that showed the, you know, the cluster of cases that we saw between 600 and 700 cases per day in Colorado for, you know, a couple days there in a row. And then we've seen a trend downward since then, with, you know, little smaller variations just based upon, you know, more testing happening during the week than on the weekends. But it's up to us. And if we continue to do what we're doing and seeing, you know, these low numbers where we're, you know, socially distancing and wearing our masks and keeping, you know, the vulnerable in their homes, then we may not have another peak if we continue to do, you know, what we need to do. It's when things are not, you know, we're not doing things to control the infection that might lead, you know, to another peak. And there are, you know, hundreds of different mathematical models out there now that will give you every date between now and Christmas about, you know, when we might peak again. But it's really up to us. And if we are good at what we're doing, if we are continuing to do, you know, again, and I keep saying it, but the social distancing, you know, staying 6 feet from folks, wearing your face covering, staying home when you're sick, washing your hands, and not gathering in large groups, we may not have another peak.
Yeah, and I'd just like to reiterate too, again, comments already kind of addressed, but you know, the business community looks to us and wants to open, and we have to realize that education piece, rather than or more prominently kind of approached than the enforcement piece for the community's behavior, will impact directly that economic kind of reboot and reopening. So I think the importance is just for all of us to be able to continue that education and commitment to setting the better example, and being cautious and considerate with each other and with our neighbors, because it will have a ripple effect across the county and the region that we really don't want to have to then work through and address.
Well, and I also want to say out loud again, and I sound like a broken record, and I'm sorry, but you don't wear the mask for you, you wear the mask for your neighbors. And that, you know, all those folks out there that we, you know, see either not wearing their mask or, you know, saying that, well, I feel fine, I don't need a mask. It doesn't help you at all. It helps your friends and your neighbors and the elderly and the vulnerable. And so part of that piece of taking care of one another is putting on your face covering so that everyone, you know, can enjoy what that means.
Lisa, that's a great point, and that's kind of the tactic that we have taken to when we're looking at this from a regional standpoint, is being a good neighbor to our regional partners so that we're not inundating them when we, or if we potentially see a spike again. So, I want to tag on to that a little bit too, Sarah. It's really important to recognize that, at least from my personal perspective, and I would imagine from my fellow commissioners' perspectives, that we empathize with you as business owners. We are in the same storm as you. We are weathering that storm with you. We are operating the county, which is much similar to a business, except our business is to provide services to you. And so, like all of you, we're having to figure out how to take care of our business community and support them through this pandemic, but also take care of the services that we have to provide to our community, knowing the huge budget deficits that we are facing going into 2021, so that we are not being negligent in the services that we're providing to you. And so I can empathize with you all and empathize with the position that you're in. And I just would ask that you all understand that we are doing the very best that we can with the data and information that we have at this given point through this pandemic.
Hey, Kayla, just to then tag on what you're saying is, it's about, yes, being good, partners to other communities. And we have to recognize that a lot of our community works in these other communities. And so if we're all doing our best to keep our communities healthy, that means we're doing our best to keep our businesses healthy, to keep our businesses open, to keep workers working, who now have an opportunity to go back to work, which hasn't been available for many folks for a while. So I think, that is part of the big picture of, ensuring that our surrounding communities are staying healthy like we are, in the sense that, providing workers and, moving back and forth between these communities, that we do stay open, all of our businesses that are able to open at this point in time. And then if you guys would like, I can give you an update as far as kind of where we're at with testing. So as of 4 p.m. today, our state is, so we have a total of 692 tests for Lake County. That includes both the active infection, so that nasal swab that we talk about, the PCR, as well as the antibody test. We are still standing at 27 positives. And for our business community who have been, sharing their social distancing protocols with us, at this point in time, we have a total of 77 applications. 52 have been approved. There are 15 of those that we'll be looking at in the next week, because they are businesses that will have an opportunity to open come June 1st. And then we have a couple of other tricky ones, because not everything's a straight, front door business kind of a business. And so we're working with all of those folks to ensure that we're doing this as well as possible. So those are just some numbers.
If I could also chime in, this is Commissioner Mudge again, with just encouraging folks to reach out to Human Services for, personal needs and whether it's with unemployment or to understand how to connect with resources for food sources at St. George's, through the CARES Act. Everything is very long and complex, and so we've really been working hard to siphon through the new eligibility opportunities. And as a private business owner, you're eligible now where you may not have been outside of the COVID event. So Human Services is there to answer questions for anyone, and it might be that you aren't eligible for some programming or support, but it's really important that everybody reaches out and tries to gain the education on those opportunities, to also share with your neighbors, and if you're a business owner, share with your employees, so that we can really try to decrease the stressors and the hardship and the anxiety that's being caused through the event.
So obviously we have time to hear if you have concerns and or any feedback on, how things are going. If you feel that they're going well and all those other pieces, that's what we're here for. So please do not hesitate to, either unmute yourself or put a question in the chat or just make a general comment. We're all good.
So I just also, it might not be, I know, again, we have been on so many of these calls, so I want to encourage folks to send the questions out into the chat and keep asking us. But I am not sure necessarily that we, kind of also highlighted all the construction projects going on in town and the challenges that might bring, as well as opportunities for marketing and getting kind of that business flow of the contractors that are in town. There are about 7 projects going on between XL gas lines, CDOT resurfacing projects, CDOT lighting at Mountain View. We have the school, the elementary school building, the airport runway project. The Tabor Opera House is going to have a project starting on their facade and other interior focuses. But so that all is ongoing. The lodging, that's been the exception for some of the lodging right now to house local workers and contractors for those essential services that have been exempt from the beginning. The other piece on June 1st, the Forest Service will open the campgrounds June 1st. And so we will be seeing an influx of folks and visitors to just the Leadville district at the campgrounds. Between Twin Lakes and Turquoise Lake, we have 511 campgrounds. My understanding is that they are not opening the group sites, as that, of course, would pose some pretty hard enforcement issues. But having that many sites, and I'm sure that they're full, in all likelihood, we will be seeing folks coming into town. So I really don't believe that we're going to be turning into a ghost town. We have to lean on each other and try to get the revenue and the interest and education out again to maintain that community behavior so that we can continue to sustain the economy as best we can.
So how are folks feeling in the sense that, what are you hearing from your family and friends? Is there anything that we might be able to direct people towards some resources and, or like I said, just general comments about where we're at?
Colleen, can you maybe touch on, we are in this first phase of reopening, and I see some new folks here who have not necessarily seen that that chart or that structure. Maybe the green, the blue, and the black diamond expert level for the 10, 50, and 250. Can you talk about again just what I think, again, reiterating, but Lisa, you said you're repeating yourself. I don't think it's, for us, might be old news, but I don't think we can say and reiterate these things enough. Can you explain to us again, we're in that phase of gatherings of 10 or more. With special events, we are happy to entertain and talk through and discuss and come up with creative ideas of ways to inject activity into the economy or support our locals, like the high school graduation, and what it would mean for us. What would it have to mean for us to be able to move into that blue, meaty, moderate kind of activity of maybe 50 plus.
Yes, absolutely. So I did just share my screen so you can understand what Sarah is referring to. we have to meet 5 criteria in order to move into the stabilization phase. And at this point in time, we are meeting those criteria, hence why we could move into that first phase, which is the green circle. I'll show you that in a second. But the criteria are a sustained decrease in cases for at least 14 days. Hospitals are safely able to treat patients without resorting to crisis standard care. Testing can be performed for all people with symptoms consistent with COVID-19 infections. Monitoring can be accomplished for all COVID-19 cases and their contacts. And clear protocol is in place that requires social distancing and assists with case identification. So we're doing all those things right now in a really great way. And so that allows us to kind of move into the stabilization phase. The last line on this that you can see is getting to the recovery phase will require that a vaccine is widely available and or treatment. So we have to recognize the fact that, you know, we are in this for a while. This isn't something that's going to change overnight. We are in this new normal, if you will. And so what Sarah is referring to is our first phase, and that's the green circle, which is initial reopening. A lot of folks want to put a date to that, and if we were to do that, I would say that first date would be May 1st. That's when we're able to start opening some of our lower risk businesses compared to some of our others. So that was like retail stores, some hair salons, nail salons, dog grooming. Some of our providers, chiropractors and dental and things like that, were able to kind of reopen, but with all of the social distancing measures in place. While we're in this green circle, you know, we continue to talk about all of these things on the left-hand side. Hand hygiene, coughing and sneezing etiquette, minimum of 6 feet, you know, protecting our most susceptible folks, you know, symptom screening and or staying at home, reporting and testing, face covering in public, face covering for sick folks, obviously isolating folks that are sick and or quarantining folks that have been exposed. And so when we look at this phase reopening, you know, with critical businesses, they haven't closed. They've been operating with social distancing protocol. And so, and some of those are exempted from gathering sizes because I know some of the questions we have, well, you know, in Safeway, they obviously have more than 10 folks. And we absolutely recognize that. And I feel like Safeway has done an amazing job at, you know, putting up the protocols, ensuring safety for their, you know, employees, you know, making things one lane, putting feet on the ground so you know it's 6 feet apart while you're in line, putting signs up saying wear a face covering to enter this space, cleaning off carts when you enter it. That's just an example of a local business. But right now we're only a gathering size of 10. And so, you know, so many of the pieces of why we're at there is because we recognize that people get infected when they're with people in close contact, you know, for an extended time. I shouldn't even say extended, but for 10 minutes or more. And you can imagine if you're socializing in, you know, groups larger than that, it's very hard to maintain that 6 feet distancing in, you know, personal spaces and in some of our public spaces as well. So it's important at this point in time that that's why we're limited, because we know when you put folks together in a room, that increases, you know, their chances of becoming infected. We also recognize that with COVID-19, that many folks will never show signs and symptoms, but have the ability to pass on that infection. And so that is, you know, another piece of the puzzle, right, that we're all kind of trying to figure out. And so with that being said, I'm going to scroll back up a little bit and maybe I'll shrink it because I think it might be a little bit easier to do it that way, trying to make it so folks can see it. But if we go back up and to get into that next, you know, phase, which is blue square, and for those skiers out there, you'll recognize these are, you know, indicative of what you might see on a ski slope. You can also recognize that the governor is using this as well as far as what he's been showing in his Safer at Home and some of the phases for reopening, and we're still in that green circle as a state. But we have to recognize that to go from green to blue, we have to be in this green phase for at least 4 to 8 weeks after this initial, like I said, if we wanted to put a date, that would be May 1st. And we have to ensure that we're not seeing a significant increases in cases and that we can meet those 5 criteria that I just showed earlier, and that we can continue to maintain them, not like, hey, we're getting to the edge and we don't think we can maintain them, versus nope, we're comfortable, we feel good about where we're at. You know, that's the whole reason why, you know, obviously why, you know, Lisa and I continue to communicate. We communicate with the hospital, you know, making sure that we're, you know, able to keep rolling on those criteria and feel comfortable about it. When you think about the gathering size, so I'll scroll back down, sorry, I know it's a little hard. You know, so if we get there in, you know, 8 weeks, we're still looking at a gathering size that might, be 25 to 50. And obviously there's some play, in those numbers, and, might be able to go a little higher, a little bit lower, depending on what we're seeing. And then the last piece being, getting up into that, the black diamond, which is expert, which, might take us, and let me just scroll up so you guys can see it, 8 to 16 weeks after our initial, reopening, which no significant increase, that those criteria are met and maintained. And I think, if we're able to continue to flow, that will be amazing for us to mean that we won't have disruption as we continue to open slowly, because we've been able to maintain all of those criteria as we moved from phase to phase. So even getting into that last phase, which if you think is 16 weeks from May 1st, right? That's 4 months. So May, June, July, August, September, that puts us, right into the fall. And even then, with doing everything amazingly well, which includes social distancing still, that does not go away, that, we might get into that 250 person group size as needed. And so I think there is opportunity as we move through this to see some creative things that might happen as far as, what we might be able to do, locally as a community. Any questions around that? I'll keep it up for like another minute and or scroll if folks do have questions.
Thanks, Colleen, for sharing that. I just want to add in here that we will have our first economic recovery team meeting tomorrow at 3:30. We'll post the Zoom link information on our Facebook page and website if anybody would like to join us. So we're starting to move through that to get our businesses a unified messaging out for folks that are wanting to visit those businesses and folks that are wanting to visit Lake County, so that everyone has the same information to stay safe.
Colleen, do you have any sense in any conversations that you've had with the school district as to what you might anticipate the school year of 2020, 2021 looking like?
No, I think that's a great question. The school has put out a survey to see, what different tracks they might be able to do with folks that include, distance learning, bringing folks in as, bringing folks in, oh my goodness, bring students in, like maybe 2 days a week and, one group, and 2 days a week, another group. I think a lot will be telling. We're going to get some guidelines around summer camps. And I think a lot of what we're going to see as far as school openings, in all honesty, really depends on what happens across the state. If we're able to maintain where we're at, all the way across the state, and even if we go all the way into that, like, expert phase, if you will, then the opportunity for students to go back to school, in a more, there'll still be some social distancing pieces in the way they position, desks and things like that, then we might be able to be less disruptive versus, hey, we saw, we continue to see a spike, we see a rise, we don't feel comfortable bringing, a large group of students into a school. And so I think a lot of it really is dependent on what's going to happen, in the next couple of weeks. I know the state has shared, their goal is to have kids go back to school, really, because, it is, ideal for a lot of folks, not everybody, right, obviously, to have, kids back in school, especially if, the economy is picking up and folks are working, and, it is a form of childcare for a lot of folks in that respect. And so I know that is the end goal of the state, but it still won't be, exactly as it was. I can't imagine that it would be. And so, I could just speculate at this point, right? But I think if you do have, any children in the district, take an opportunity to fill out that survey so the school can do their best to, serve each student's needs. Because we also recognize there'll be a lot of families that even if the doors, open on August 17th, which is the first day of school, there'll be a lot of families that might say, hey, no, I don't want to physically bring my child in. And obviously, the school has to work around those things as well.
Thanks, Colleen. I had a similar question to that, and I had asked that on our meeting with CCI today, our legislative advocacy group, about what that looks like going into the fall and continuing the social distancing and the thought of remote learning for those students that have IEPs or independent educational plans and how they would receive those services. And I think that that will look a lot different for us in rural communities because we have such a need for resources here anyway, that, you know, those are conversations that we definitely want to keep having with the school district and our state representatives to be sure that those issues are being brought up as well.
If I just might add, there was a conversation that happened today amongst myself and the school officials about developing these guidelines, and so using again the data of infection rates to ensure that our kids will be safe, and also talking about testing for the students who are going back to school in a grand scheme, so that we can identify, you know, those who are infected, those who are asymptomatic carriers, and then quarantine them appropriately. So it's in the works, and we'll obviously continue to update people as more information is made available.
I'd just like to take an opportunity, this is Commissioner Mudge again, to make a statement that I really appreciate, you know, Janine McGee, our Human Services Director, comments on this every once in a while, but to remind folks and that, you know, typically in a emergency or disaster, we're talking about a wildfire potentially, right? In our case, where we have the physical destruction, we have a limited, you know, we know what we need to do, we evacuate folks, and then we plan and plan the tactics of the cleanup. We know who's been displaced from their homes and who's in a shelter, and the actual, you know, the families and the folks that we need to talk to and give our attention to. We are responding, continuing to respond to this event as we go into recovery. This is not something that most any of us have, you know, experience going through with the longevity of the, you know, having to respond through recovery. So as much as we would love to, well, let me say, we acknowledge we cannot reach out to everyone in need, and so please encourage folks to reach out to us. Sorry about that. To ask these questions, you know, get the information to share with your neighbors, you know, and it's changing. So please continue to reach out to the local elected officials and leaders to educate yourself. But you know, this is different than a wildfire, and we are absolutely doing our best to meet everyone's needs in the community.
So Beth is sharing some great things in the chat, as well as Josh Adamson from our Office of Emergency Management about some just informational resources, some things that went out to businesses specifically this morning, and kind of how we're picking those pieces in the process. Anybody wanting to share tonight? I recognize that every week it's a lot to digest. There's, you know, as we know, it's ever changing. You know, we're all looking for that information and figuring it all out together. So I also appreciate, you know, patience as we kind of work through this process together. So this is kind of our last call for questions.
Thanks, Colleen. I just want to add on to that both Commissioner Mudge's contact information, my contact information, and Commissioner Glenn's contact information is on our county website. If you click on our names, it will send you to an auto-populated email address, so you can connect with us there. If you have any questions, please feel free to reach out to us and we will do our best to respond to you. Beth is also typing our contact information in the chat. So thank you all for participating tonight. We appreciate it. We appreciate your understanding and your patience as we are all navigating through this and doing the best work that we can to ensure our community comes out better than we went into it. So thank you.
Thank you all.
Yeah, we just gave you 15 or 12 minutes back into your day, if you will, that you may not have anticipated having. So use it wisely. Thank you so much. Be well, and we'll see some folks next week. Thanks.
Thank you.